And if you could give us an example that you'd like to highlight in regards to the journey you all are on with customer experience.
Thank you for the question. And I have to say, it's so funny because as Charlotte was speaking, I wanted to highlight the how we got there behind this historic 21.3 million people.
Who's counting?
But who's counting? Who chose ACA marketplace coverage? I mean, this is unbelievable, not only when we think about the impact it has on individuals across the country at these moments that matter, it is also really remarkable in terms of how we got there. I joined CMS a few years ago. I am the first to acknowledge that when we are talking about customer experience, it's not this one project or one initiative or one win. And it's certainly not a pat on my back, so to speak, right? There have been folks at our agency working really hard to meet people where they are for decades. And so I feel very humbled to be able to pull the curtain aside a little bit and note the headlines and what you hear are wonderful. How we get there, I think, is the real story, because in the last 5 years in particular that I've had the privilege of working across our agency and beyond across government, what I have noticed is one of the secret sauces, if you will, behind the scenes is our ability at CMS to be constantly critical and pushing ourselves to deliver better, even when something may be a historic milestone. And to give you an example of this, so about 5 years ago at our agency, we started the Human-Centered Design Community of Practice. This was a group of designers, customer experience specialists, perhaps not in name, but in everything but, daily doing the work from data to communications to user research across every facet of the capability. And we brought folks together. We started with an N of 3. We suddenly saw that number creep up to, over 100 people, suddenly crept up over 300 people when we started to bring not only the individuals across our agency in the federal space, but also our partners. And that groundswell that started as a grassroots movement to make sure that we are making healthcare more human and doing that in a way that we are building ourselves up as teammates and making sure we all have the ability to ask the right questions from the outset has gotten us to a place where now we have been working on our MVP of a customer experience center of excellence. And what I want to highlight here is we made the decision that we weren't from the get-go going to set up a CX office. And the rationale behind that and why it matters is we believe that CX is part of and needs to be part of our agency's DNA, just like our focus on health equity, just like our focus on being able to make data-driven decisions. And just because we have the data and just because we may have the ability to centralize that, so to speak, the power in what we do every day is asking the right questions and making sure we're moving together. So that is, if our what is this historic number of folks who have coverage, our how is really folks that are self-organizing and then raising at the right place and time what they need at the individual contributor level across the country to say, we know that we're seeing this need on the ground and we want to make sure we not only next time around, we don't always only see it, we anticipate it.